This training module is a collaborative effort between pharmacy and the emergency department team. Why administer some IV drugs push? Consider the case of a 42-year-old alcohol withdrawal patient. The patient will obtain full concentration of the prescribed volume in a timely fashion. The nurse will not have to don and off multiple times simply to flush the lines, especially if this patient is COVID positive or in an isolation room. The therapeutic effect have a much earlier onset than otherwise. How to safely administer medications IV push. The adherence to the rules of safe medication administration will guide us in ensuring that the drug can actually be given IV push, and that the preparation is done appropriately, and that the evaluation and monitoring is done accordingly. A quick reminder of the rights of medication administration. It must be the right drug, the right patient, the right dose, the right route, the right time and frequency, the right documentation, the right assessment, the right drug approach, including the right to refuse, the right interaction, and finally the right education. The 11 drugs that are included in this pilot launch of IV medication push are dexamethasone, D50, Valium, Gravol, Benadryl, Lasix, insulin, Toradol, morphine, Piptazo, and unfractioned heparin. Please notice the guidelines for reconstitution and particularly the administration time, as this must be respected at all times to prevent possible severe adverse effects. An easy way to adhere to the administration time is to count either 6, 10, or 20 seconds between infusion of every milliliter of the drug prepared. For example, when administering a final concentration reconstituted in 10 milliliters, for every 6 seconds, if you push 1 milliliter, the drug will have been administered over 1 minute. A few notes to remember. The clinical context and your clinical judgment must guide your decision to administer the medication IV push or not. There are expected benefits in terms of process improvement, time, efficiency, patient experience, and safety. Practice reconstitution to avoid contaminating the multi-use vials, for example that of dexamethasone. Special care must be taken to assess and monitor patients very closely for adverse effects, particularly since the drug will be readily available in the system in a much shorter period of time. Thank you for listening. To check your understanding, please pause the video to scan this QR code for the quiz. Thank you.